Epinephrine. Epinephrine, the classification would be an adrenergic agent or an inotrope. What does it do? The action? It binds strongly with both alpha and beta receptors, and by doing this causing an increased blood pressure due to vasoconstriction, increased heart rate due to increased automaticity, and bronchodilation. Indications of when we're going to give epinephrine: someone with bronchospasms, having an allergic reaction or anaphylactic reaction, and when someone's in cardiac arrest. What are some of the adverse effects? Anxiety, headache, cardiac dysrhythmias, hypertension, nervousness, tremors, chest pain, and nausea, vomiting. Contraindications to giving epinephrine to someone: someone who's having dysrhythmias other than pulsus, VTAC or VFib, asystole, or PEA. Someone who has cardiovascular disease, hypertension, cerebral vascular accident, shock secondary to causes other than anaphylactic, such as hypovolemic shock. You're not going to want to treat them with epinephrine. You should actually treat them with volume replacement. Someone with a closed angle glaucoma, except in the emergency setting, of course. Diabetes, pregnant women with active labor, known sensitivity to epinephrine or sulfites. Let's talk dosages. In a cardiac arrest, your initial dosage will be 1 milligram of the 1 to 10,000 solution. You can give that IV or IO. You may repeat every 3 to 5 minutes. The pediatric dose for cardiac arrest: the initial dose will be 0.01 milligrams per kilogram of the 1 to 10,000 solution, either the IV or IO. Repeat every 3 to 5 minutes as needed for a maximum dose of 1 milligram. Symptomatic bradycardia: the adult dose will be 1 microgram per minute of the 1 to 10,000 solution. As a continuous IV infusion, usual dosage range is somewhere between 2 to 10 micrograms per minute IV, and you titrate to your effect. Pediatric: there'll be 0.01 milligram per kilogram of the 1 to 10,000 solution, IV or IO, may repeat every 3 to 5 minutes for a maximum dose of 1 milligram. Does it sound familiar? It sounds like the cardiac arrest dosage. If you're giving epinephrine by the ET tube, endotracheal tube, you want to administer 0.1 milligram per kilogram. Asthma attacks and certain allergic reactions: the adult dose will be 0.3 to 0.5 milligrams of the 1 to 1,000 solution, either IM or subcutaneously. You may repeat every 10 to 15 minutes for a maximum dose of 1 milligram. The pediatric dose will be 0.01 milligram per kilogram of the 1 to 1,000 solution, IM or subQ, for a maximum dose of 0.5 milligrams. Anaphylactic shock: the adult dose to be 0.1 milligram of 1 to 10,000 solution, IV, slowly over 5 minutes, or an IV infusion of 1 to 4 micrograms per minute, titrated to effect. The pediatric dose would be a continuous IV infusion rate of 0.1 to 1 microgram per kilogram per minute of the 1 to 10,000 solution, titrate to response. Special considerations: epinephrine has a half-life of 1 minute. And you want to use caution with pregnancy in Class C.